Welcome to Care Talk Shorts, where we focus on one specific and timely issue instead of tackling a whole bunch at once. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, an American hero died recently, Senator John McCain. A lot of retrospectives to him, even though he wasn't principally known for health care. Let's talk about health care and Senator McCain's role there.
Great topic for him. I mean, he sadly lost his battle with brain cancer recently, but I think will be well known for his sort of kick save at the end of the process this year of Obamacare. And I think it speaks to his principled way of governing. I mean, he really consciously was thought about the repeal and replace as a two-part program, and he was not going to live with a repeal without replace. But that is although that's the headline, there's actually a long history of John McCain being that kind of playing that principled voice on an issue that I don't think people realize that he was quite substantive on, which is healthcare. I mean, do you recall some of the things that he stood up for, David? I mean, it's a pretty long list.
Well, John, one of the surprising things was that back in 2008, when healthcare was just not on the Republican agenda, he actually made an issue of it. And he actually had a couple of interesting proposals, one of which was to get rid of the tax deductibility of health insurance premiums and put everybody on a level basis.
Too much, but
maybe too much.
It wouldn't have worked.
It was a radical kind of a move, and trying to put everything on a level playing field. I actually think it fit with his general idea of, hey, somebody shouldn't be penalized because they get their insurance some way that's different from somebody else. So that was one part of it.
Yeah, I think there's a little bit of a Republican lust for tax deductions and fear of government mandates. I don't think he ever got around his issue with the individual mandate, which without a mandate to actually get health insurance, you're fighting against the rules of underwriting, which require that as the larger the group gets, the lower the cost for every individual member. But having said that, he was a principled progressive in many ways, supporting Child Health Plus to cover the 11 million children who were near poor or near poor who needed coverage. He was for expanding community health care clinics, federally qualified health care clinics. He was for a lot of progressive things. He just couldn't get his head around a federal mandate, and I think that's, again, speaks to his principled Republican roots. And to your point, idea-driven. I mean, each one of these ideas was supported after, he vetted them and decided they were important. And that kind of responsible republicanism appears to be in short supply these days in the Senate. And I think it's a great loss to his family, a great loss to the foreign policy establishment. But people might be missing, it's also going to be a loss for a leader on the Republican side who stood up for a lot of important healthcare causes.
Well, John, unlike some of the people that are real healthcare wonks, I think about like Bill Clinton or Barack Obama or Hillary Clinton, he was not a healthcare wonk, but he actually did things that were related to public health a little more broadly.
Oh, yeah.
So I would include things like the Americans with Disabilities Act, his role that he played in climate change.
Remarkable.
Is a very big area.
People have forgotten about it.
Like back in 2000, he really took this on, again, surprising in his presidential campaign, an issue that Republicans certainly weren't talking about, and he really brought it to the fore because younger people were asking him about it, and he saw this as really a huge issue. We've talked about it, on Care Talk about climate change as being really incredible public health and healthcare issue.
Potentially the largest global healthcare issue that will emerge, and he approached it in a bipartisan, market-oriented way. I mean, it was a very, again, he gets there's a lot of press about how funny he was and how explosive he could be, but not enough about how substantive he was across a whole raft of issues, and particularly in healthcare. On the public health side as well, he was an early advocate for restricting the rights of the tobacco barons to kind of market their poison. I mean, he was a pretty reliable supporter of government mandates and solutions that were in the public's best interest. And again, it shows up also around innovation. He was very supportive of wiring healthcare and making healthcare records available, and also looking to reduce errors. I mean, his track record's really quite good, but not terribly well known.
I think it's worth talking a little bit about the bipartisan nature of what he did and remind people that it's not about nonpartisan, because he was a conservative Republican, but it was about building a coalition for something that could get 60 votes in the Senate. And I think we're seeing the importance of that now. For something to be durable, is that if it just passes with one party, when somebody else comes in, it's just going to be flipped. So it's not just about yearning for the good old days. It's what I think what we need to get back to.
Well, that's not a partisan issue. That's something the Democrats have learned, to their peril with Obamacare. But I think that what's interesting about one of the many interesting things about John McCain is he actually enjoyed the fight, enjoyed taking the fight to the other guy, and was pretty tough from a rhetorical perspective. But it was never personal. And that comes across in battle after battle, where he actually, some of his great friends in the Senate were the most liberal guys in the Senate, Teddy Kennedy and Joe Biden. It's pretty remarkable.
Well, John, on that note, I think it's a good spot to end. Really a lot to say about Senator McCain in a lot of areas, including health care, and it's been good just to catch up with you on this.
Well, I just think it's important to celebrate and recall the principled Republican progressive on healthcare that John McCain was, and hope that his lessons and what he showed through his example and leadership will be learned by the next generation of Republican leaders.
So that's it for this short version of Care Talk. If you like what you see and what you hear, please subscribe using your favorite service. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.